Hi everyone. Today we're going to discuss the topic that is pharyngitis. Okay, so about the pharyngitis, we'll discuss today the topic that is the pharyngitis. So here you can see in the picture about the pharyngitis. So these are the normal and this is abnormals. Okay, so this pharyngitis, that is a upper respiratory disorder. Okay, so first of all we have to know the this about the pharyngitis. So pharynx itis, pharynx plus itis means we know that is a inflammation. So uh, in this pharyngitis, the normal pharyngitis will be look like this, and in abnormal pharyngitis it will look like this. So there will be the throat redness, white spot will be there, white spot like this, and solvent tonsil. Okay, so let's see the definitions of pharyngitis. The definitions of pharyngitis, that is pharyngitis is inflammations of the pharynx. Okay, so pharyngitis is the inflammations of the pharynx, that is in throat, which can be acute or chronic. So pharyngitis, it can be acute and chronic also. Acute means it may be a short durations, it will take times, and chronic means it may be more than 1 weeks, 6 months it may go. Next we'll see that is etiology. So what are the etiology? The etiology means what are the causes of a pharyngitis. So etiology of pharyngitis, that are first thing is what? Viral infections. So viral infection due to like influenza, common cold. And next we'll see bacterial infections. Like which bacterial is streptococcus aureus. So due to these bacterial infections, it may lead to a pharyngitis. Next causes, that is allergies, irritants. Okay, due to example here is there smoke, dust, chemicals. Due to chemicals, smoke, dust, it may lead to a pharyngitis. And next causes gastro esophageal reflux disease, GERD. So due to GERD, it may lead to a pharyngitis. Next we'll see clinical manifestations. So the other name of clinical manifestations, that is sign and symptoms. Sign and symptoms. So dysphagia means difficulty in swallowing will be there, sore throat will be there, painful swallowings while you are swallowing, that times pain will be there, fever will be there, cough, runny nose, and headache will be there. Headache, fatigue, swollen lymph nodes, redness, and swelling of the pharynx. Okay, redness will occur and swelling of the pharynx. In the pharynx area, the redness and swelling will be there. So these are sign and symptoms of a pharyngitis. Next we'll move on in diagnostic evaluations. So in diagnostic evaluation, first of all we have to do that is a history collections and physical examination. History collections and physical examinations. Next things we have to do, that is a throat culture test or rapid strip test we have to perform. Next we have to do that is a CBC, complete blood counts. And next test, that is a imaging studies. It will come under like example X-ray, CT scan. If complication is suspected, okay, then only we will going to do this imaging test. So these are the tests we will do in a diagnostic evaluations. Next we'll move on to a medical management. So in medical management, first things here you see viral pharyngitis. If it is a viral pharyngitis, then what care, what medications, what managements we have to do, that is supportive care such as like rest, hydrations, pain management. And next is what antiviral medications. Will provide a antiviral medications. What do you mean antiviral medications? Anti means against, anti means a, anti means a against, viral means we know that's viral, against the viral. uh, will provide antiviral medications against the virus. Will provide a medications. Example, here against which virus will provide? Against herpes simplex, for example, herpes simplex. Next, that is bacterial pharyngitis. So for bacterial pharyngitis, will provide a medication, that is antibiotic medications. Example, penicillin, amoxicillin. Next, pain management. So in pharyngitis we already show that pain is there, difficulty in swallowing, painful swallowing is there. So for that we will provide acetaminophen and ibuprofen. So these are the medications for a pharyngitis. So next we'll move, that is a nursing management. So in nursing management, as a nurse, what we have to do, we have to assess the pain and discomfort. Okay, we have to provide emotional support should be there. We have to encourage rest and hydrations. We have to administer uh, uh, medication as prescribed, means here as per the doctor prescribed. We have to administer the medications such as like pain medications, uh, for fevers, paracetamol. These all medications we have to administer. Next, we have what we have to do, we have to monitor the complications. And next, that is educations. Okay, educations on good hygiene practice, throat care. Example like gargling, lozenges. Okay, and follow-up appointment. So these are the educations on a pharyngitis. If any person is suffering from pharyngitis, then we have to tell the health educations about good hygiene practice. So throat care, follow-up appointment. Okay, so next we'll see that is a complications. So complications here, tonsillitis, that's we know the inflammations of the tonsils. Laryngitis, that is what inflammations of the larynx. Otitis media, that is otitis, middle ear infections. Oto means we know ear, itis means inflammations, media means middle, so middle ear infections. And next is what sinusitis. Okay, sinusitis, abscess formations will be there, rheumatic fever. Okay, so these are the complications of a pharyngitis. So today we have discussed about we learned about pharyngitis, under that causes, definitions, causes, signs and symptoms, diagnostic evaluations, medical managements, nursing managements, complications. Okay, so these are the topics we have studied today.